We begin tonight with Idaho's inclusion on a report prepared for the White House Coronavirus Task Force. The unpublished report obtained by the Center for Public Integrity suggests Idaho and 17 other states in the so-called red zone should revert back to more stringent protective measures to slow the spread of COVID-19. The Center for Public Integrity says an earlier version of that same report was also sent to governors. Today, our Misty Inglet spoke with a doctor from the state coronavirus task force to hear his concerns about our recent spike in cases.
I'm actually even more concerned about this than I was the first spike that we had.
In the last few weeks, Idaho has reported anywhere between 300 to 600 new coronavirus cases a day. Right now, our daily average sits at roughly 510 cases. Dr. David Pate sits on the state coronavirus task force, and what he sees concerns him.
We're not peaking and coming down. Some people think that. I don't believe it. We're going up, and it's going to get worse when school opens.
A recent report compiled for the White House Coronavirus Task Force lists Idaho as one of 18 states in the red zone, meaning there were more than 100 new cases per 100,000 people.
What this tells me is while people look at the numbers and they'll see 500, 600 cases and they'll think, wow, that's a lot and a big spike, I'm more alarmed because for every one of those, there's probably another 4 to 10 people out there who are infected and have no idea.
The same White House report also looked at states with positivity rates higher than 10%, including Idaho.
What we're seeing is close to 15% here.
Ideally, Pate says that number should be less than 5%, meaning for every 100 people tested, 5 or fewer should come back positive. According to Pate, the spike in cases, the increased positivity rate, and the fact that more young people are getting infected means more severe cases are on the horizon.
As long as there's timber for this wildfire and you're not putting water on the fire, it's going to spread. And that's our situation. This is the time for us to act. We need to do things now because anything we do is going to take 2, 3, 4 weeks to make a difference anyway. So you don't wait till you get in that crisis situation.
In Boise, Misty Inglet, Idaho's News Channel 7.
Dr. Pate says some areas of Idaho are doing well with low spread of the virus. He urges people, particularly in harder hit areas, to wear a mask for the next few months to help slow the spread, especially before school resumes.